All right, this is Dr. Michael Mueller, and today we are going to talk about a peptide that was an absolute game changer for me, right? Me personally, when I suffered an injury to my elbow. Now, if you don't know me, folks, my name is Dr. Michael Mueller. I'm a family physician with a background in longevity medicine and wellness medicine, and I love peptides. And I also love living my best life. And I try to be sure that my patients can live their best life. And we do that by taking steps to slow the aging process and to help the body heal. And peptides like BPC-157, which is body protection compound 157, peptides like BPC-157 have been game changers when it comes to the healing of injuries, right? And I'm going to talk about a pickleball injury that I suffered and how it nagged and nagged and nagged, and how I used BPC 157 to recover from that. And we're going to talk about how BPC 157 works, and we're going to talk about the proper dose for my specific situation. Now, remember, folks, everything here is for entertainment and education only. I am not your physician. So if you need medical care or medical advice, please see a physician. Please see your physician. But BPC 157 is a peptide, folks, that has been around for quite a long time, since the early 90s, maybe even the late 80s. And what it does is it helps repair injuries, specifically tendon injuries, ligament injuries, muscle injuries, inflammatory issues. It really is a true wellness peptide, right? Now, I had hurt my elbow years ago. I love to exercise. I work out. I go to the gym. I walk. I do anything and everything I can to stay healthy. But years ago, I had injured that elbow while I was in the military. And that elbow injury has nagged for years. Well, then I picked up this wonderful new game called pickleball. And boy, if you like pickleball, folks, hit the like button, subscribe, give me a thumbs up. I started playing pickleball. I love pickleball because it's like playing ping pong, except you're standing on the table with a racket. So it's also tennis like, but it's a fast game, it's a fun game, and it's a game that anybody at any age can play well. So I love pickleball. I was playing pickleball so much that my elbow became almost useless. In fact, my right elbow was bothering me so much, I couldn't even use the mouse on my computer comfortably without having pain. So, I work in the anti-aging space. I'm a wellness physician, and I know all about peptides. So I said, I'm going to go ahead and try a little BPC 157. Now, you can take this medication one of two ways. You can inject it, right? Or you can take it orally. In fact, it's one of the few peptides that truly works well orally because it absorbs well in the gut and the intestinal tract. In fact, it was discovered in the stomach by a Russian scientist many years ago. And in the rat studies, they did some interesting rat studies with BPC 157, and they severed the Achilles heel or the Achilles tendon of some rats, and they gave a group of rats the BPC 157 and another group nothing. And the group that took the BPC 157 had spontaneous healing of their severed Achilles tendons. So in the rat studies, this thing was quite miraculous. And again, we're not rats, but this data, this information, this conclusion found in the study may translate over to humans also. So I said, I'm going to commit to it. I'm going to take it. And then I figured since I did, I'd chat with you about it. And I'll tell you a little bit how it works. Well, what it does is BPC 157 increases the expression of vascular endothelial growth factor. Okay. And what this does is it stimulates new formation of blood vessels to the area where the damage is. It helps increase the circulation to the area where the damaged tendon is. And this allows for better oxygen delivery. It allows for nutrients to go to the area. And it allows for specific cells in the body to go to the area and repair the damage. And that is one of the ways that BPC 157 works. And it also enhances growth factors, meaning growth factors are the factors in the body that help you to recover from an injury. And this actually causes the body to send more fibroblasts to the area. And these are cells that produce connective tissue. meaning these cells can make new connective tissue to fix the area where the tendon or ligament was damaged. So that's how the rats hypothetically were able to repair their own tendons, because of the work of the fibroblasts in the area where the injury occurred. And the fibroblasts went there because of the BPC-157. It also has anti-inflammatory effects. It's just got a lot of good other things that it does. It's really kind of beyond the scope of today's video. But what BPC-157 does is it helps to protect tendons and ligaments. It helps to repair damaged tendons and ligaments. It helps with inflammation, and it enhances growth factors that allow damaged tissue, ligaments, tendons, etc., to repair themselves. So that's how it works. In essence, BPC-157 kind of acts as a biological switch that triggers and enhances the body's intrinsic healing mechanisms, allowing the body to heal itself. And if you have issues in the gastrointestinal tract, like Crohn's disease, colitis, irritable bowel, that type of thing, oral BPC-157 works well for this. So I told myself I'm going to commit to this, right, for X amount of time. And that X amount of time was 8 weeks. And I said, okay, I'm going to commit to it for 8 weeks, and I'm going to do the injectable form. So I injected it into my right arm, just above the area where the damage occurred. And I was using about 300 micrograms 3 days a week. And I did that for 8 weeks. And again, this isn't medical advice. I'm not telling you what to do or what dose to take. I'm just kind of telling you what I did hypothetically, right? So I did this for 8 weeks. And honestly, after the first 2 weeks, I was already noticing less pain, right? By week 4, the pain was completely gone. But, I do this for a living. So I said, well, I'm not going to quit just because the pain's gone. I want this thing to heal totally. Okay. So I finished out my 8 weeks. In fact, probably about 6 weeks in, I was kind of just giving myself the shot subcutaneously in the abdominal area under the skin. And I kind of forgot that my elbow was even hurting. In fact, I noticed at the office, I was doing things with the computer. I was, going to the gym and doing what I normally do. And the elbow just was not hurting. I got off of it after 8 weeks. The pain did not return. But I must say, probably about 8 or 9 months later, I did something silly, right? And did kind of irritate that tendon again. I went on a short course of BPC-157 again for a month, and that healed itself. Now, there's also the Wolverine protocol, folks. And that's a combination of BPC-157 and TB500. If you missed my video on the Wolverine protocol, you might want to check that out, because that mixture, those two peptides together, work synergistically to even get a better outcome than what you would get with just BPC-157 alone. So folks, I'm back to pickleball, right? I'm feeling good. The BPC-157 worked for me. And if you have an injury, or a tendon problem or a ligament problem or a muscular problem or an intestinal problem, then BPC-157 might be good for you. And it has benefits beyond those specific issues, but we'll talk about those at a later date. So thanks for listening. Have a wonderful day. Know that your life is your choice. So make good choices, live a healthy life, and all will go well. Have a good day, and thanks for listening. Bye.